This content is for educational and informational purposes only. It is not intended as medical advice. Always consult your healthcare provider before making any changes to your diet, exercise, or medication.
Father and mother, it turns out there are two sleeping positions that may increase the risk of stroke during the night without many people realizing it. Father and mother, these sleeping positions are very common and may even be your favorite sleeping position every night. And what's most surprising is this: these positions can repeatedly disturb your breathing while you sleep, causing the body to get less oxygen and making the heart work harder. But don't worry, in just a moment I will explain which sleeping positions need to be watched carefully. So please stay with me until the end, because this important information would be a shame to miss. And please, don't forget to like and subscribe to this channel. Now try writing in the comments below, do you usually sleep on your back, on your side, or do you change positions often during the night? Let's share with each other and say hello in the comments. Father and mother, have you ever woken up in the morning feeling even more tired than before you went to sleep? Maybe your head feels heavy or your breathing does not feel fully comfortable when you wake up. Many people think this only happens because of aging, because of exhaustion, or because they did not sleep long enough. But there may be another reason that people often do not realize. It could be your sleeping position. It may seem like a small thing, but some heart doctors and health researchers have started paying close attention to the fact that certain sleeping positions may make breathing problems during sleep become worse. And when these breathing problems continue night after night, the body may receive less oxygen, blood pressure may quietly rise, the heart has to work harder, and even the risk of stroke may increase. That is why today we're going to talk together about why certain sleeping positions may affect the body's health, especially the blood vessels in the brain and the heart. This discussion is not meant to scare father and mother, but to help you better understand your own body, so we can all start paying attention to small daily habits that may actually be very important. So please stay until the end, because later we will also talk about a sleeping position that is often considered better for helping breathing during the night. Father and mother, before we go further, take a moment to think about this. When you sleep, what position do you use most often? Do you usually sleep on your back, on your side, or do you change positions many times during the night? Many people feel more comfortable sleeping on their back because it helps the body feel relaxed, the back feels straight, and it seems more comfortable for resting. However, according to several international studies, for some people, especially those with breathing problems during sleep, sleeping on the back may actually make the airway become narrower more easily. Why does this happen? Because when the body is lying on the back, the tongue and the soft tissues around the throat can fall backwards because of gravity. This can narrow the airway, making it harder for air to flow smoothly. As a result, the body may experience a sleep-related breathing problem known as obstructive sleep apnea. Many people do not realize they have this condition because it happens while they are asleep. In fact, some people believe they are sleeping peacefully, even though their body may be experiencing repeated drops in oxygen levels throughout the night. Some common signs may include loud snoring, waking up often during the night, a dry mouth in the morning, feeling sleepy during the day, or waking up with a heavy feeling in the head. Father and mother, the reason this condition deserves attention is because sleep apnea is not only related to sleep, it is also closely connected to heart and blood vessel health. When breathing stops for a few seconds again and again during the night, oxygen levels in the body can drop. The body then reacts as if it is facing an emergency. The heart beats harder, blood pressure rises, and stress hormones increase. If this continues for many years, the blood vessels may experience more strain and pressure. This is why doctors have started paying close attention to the connection between sleep apnea and a higher risk of stroke and heart disease.
Father and mother, there was an international study that looked at sleeping on the back in stroke patients. In that study, researchers found that patients who slept on their backs more often tended to have more severe breathing problems during sleep. They discovered that breathing disturbances became worse when patients slept in the back sleeping position. This means that when body position changes, the level of breathing problems can also change. So this shows us that sleeping position really can affect breathing quality during the night. Just imagine this for a moment. The body may be asleep for many hours, but if breathing keeps getting interrupted again and again, the body is not truly getting deep and healthy rest. The brain may also experience repeated drops in oxygen levels, even if it only lasts for a few seconds at a time. If this continues for many years, it is certainly not good for the body. Father and mother. Another interesting thing about sleep apnea research is that many people do not realize they have this condition. That is because the symptoms are often considered normal. For example, feeling tired easily, feeling sleepy during the day, or waking up with headaches. Some people even think snoring is simply a sign of deep sleep, but in some cases, very loud snoring can actually be a sign of blocked airflow during sleep, especially if it comes with pauses in breathing at night. Sometimes a husband or wife notices the problem first. For example, they may see someone stop breathing for a few seconds and then suddenly gasp or jerk awake again. That is why it is very important to pay attention to the small warning signs from the body. Father and mother. Another study also found that many stroke patients spent most of their sleeping time lying on their backs, and this position was linked to more severe breathing problems during sleep. Researchers have even started considering whether changing sleeping position could help reduce breathing disturbances in some patients. Of course, this does not mean sleeping position is the only cause of stroke. Stroke is influenced by many factors, such as high blood pressure, diabetes, high cholesterol, smoking, lack of physical activity, unhealthy eating habits, and sleep disorders. But these studies help us understand that sleeping habits may also affect overall health. Father and mother. Many times we focus only on food, medicine, or exercise, but forget that sleep is also a very important part of health. During sleep, the body performs many recovery processes. The heart gets a chance to rest, blood vessels adjust blood pressure levels, the brain clears waste products from daily activity, and the body's hormones work to keep everything balanced. If sleep quality keeps getting disturbed, the body's recovery process can also suffer. That is why improving sleep quality is not only about sleeping longer, but also making sure the body can breathe properly throughout the night. Father and mother, please try to notice something. Have you recently been waking up with symptoms like these? A heavy feeling in the head, a dry mouth, a racing heartbeat, or still feeling tired even after sleeping for many hours? If so, the body may be giving signals that your sleep quality is not yet optimal, especially if there is a habit of loud snoring at night. In some people, sleep apnea is also connected to high blood pressure that is difficult to control. This happens because every time breathing is interrupted, the body experiences repeated small stress responses throughout the night. Over time, this can quietly increase blood pressure during sleep. And remember, high blood pressure is one of the biggest risk factors for stroke. So the connection between sleeping position and stroke is mostly related to breathing problems and blood pressure, not because a sleeping position directly causes stroke suddenly. This is important to understand so the discussion stays accurate and not misleading.
Father and mother. There have also been international studies showing that sleeping position can greatly affect how severe sleep apnea becomes. In those studies, sleeping on the back was found to be the position most likely to worsen breathing problems in many patients. Meanwhile, sleeping on the side may help some people keep their airway more open during sleep. Why can sleeping on the side help? Because when the body is turned to the side, the tissues in the throat are less likely to fall backwards. This can help air flow more smoothly while sleeping. Of course, not everyone has the same condition. Some people feel better when sleeping on their side, while others may still need medical checkups and proper treatment. So this discussion does not mean everyone should be afraid of sleeping on their back. It is simply to help us understand that for certain people, especially those who have breathing problems during sleep, sleeping on the back can sometimes make the condition worse. Father and mother, another important thing to understand is that sleep apnea is more common in people with certain health conditions. For example, being overweight, having a larger neck size, getting older, smoking, drinking alcohol often, or having high blood pressure can all increase the risk. Because of this, when someone already has these risk factors and also has poor sleep quality, the body can experience even more strain. Sometimes a person feels completely healthy, but their blood pressure may actually rise during the night because of breathing problems they do not notice. This is why some doctors call sleep apnea a hidden condition. The symptoms are not always obvious, but the long-term effects can slowly affect overall health. Father and mother, besides stroke, breathing problems during sleep are also linked to other health issues. These may include irregular heartbeat, coronary heart disease, constant tiredness, trouble concentrating, and even a lower quality of life. People whose sleep is frequently interrupted are also more likely to feel sleepy during the daytime. This can increase the risk of accidents while driving or doing daily activities. So sleep quality truly affects many parts of everyday life. That is why sleep should never be seen as just a time to close the eyes. Sleep is an important time for the body to repair and restore itself. Father and mother, some people may ask, is sleeping on the back always dangerous? The answer is no. Many people remain healthy even if they often sleep on their backs. However, for people with sleep apnea or certain breathing problems, sleeping on the back may worsen the narrowing of the airway. So the most important thing is understanding your own body condition. If your sleep feels restful, your breathing feels normal, you do not snore heavily, and you wake up feeling refreshed, there may not be a problem. But if there are signs such as feeling tired easily, loud snoring, or waking up many times during the night, then it may be time to pay closer attention to sleep quality. Father and mother, sometimes small changes in sleep habits can make a meaningful difference. For example, trying to sleep on a regular schedule, reducing late nights, avoiding large meals before bedtime, and choosing a sleeping position that helps breathing feel more comfortable. Some people also feel that sleeping on their side helps reduce snoring. In addition, maintaining a healthy body weight is very important because excess weight can place more pressure on the airway. Regular physical activity also helps support heart and blood vessel health. So in reality, healthy sleep cannot be separated from a healthy lifestyle overall. Father and mother, now try to look at your sleeping environment at home. Is the room too hot, too noisy, or does something often make sleep uncomfortable? Because sleep quality is influenced not only by body position, but also by the environment around us. A comfortable sleeping environment helps the body get better rest. It is also helpful to reduce phone use before bedtime. The light from screens can disturb sleep quality. Sometimes the body feels tired not simply because of lack of sleep, but because the quality of sleep itself is poor. Father and mother, there is another important thing many people do not realize. Some people have sleep apnea even though they appear completely normal. Not everyone with sleep apnea is overweight or elderly. Each person's airway structure is different. Some airways are naturally narrower, while others collapse more easily during sleep. That is why it is important not to assume everything is okay just because the body appears healthy. It is still important to pay attention to sleep quality and to any warning signs. If a husband or wife often says that father or mother snores very loudly or seems to stop breathing for a few moments during sleep, that should not be ignored. Father and mother, research about sleeping positions and sleep apnea is still continuing today. Researchers are trying to better understand how body position affects airflow during sleep. It turns out that even small changes in the position of the head and body can affect the space inside the airway. That is why some sleep treatments also involve training certain sleeping positions. Of course, some conditions still require proper medical evaluation, so it is important not to try treating yourself without fully understanding your body condition first. Father and mother, the most important message from today's discussion is this: the body often gives small warning signs before a health problem becomes more serious. Sometimes those warning signs appear as poor sleep quality, frequent daytime sleepiness, or waking up still feeling tired. Sadly, many people ignore these signs for years. Good sleep is an important part of protecting the health of both the heart and the brain. So starting tonight, try to pay closer attention to your sleep quality. Does your breathing feel comfortable during sleep? Do you wake up feeling refreshed? Or do you still feel tired even after sleeping for many hours? Father and mother, besides paying attention to sleeping position, there are also several other habits that can help lower the risk of stroke in general. For example, keeping blood pressure stable, reducing too much salt intake, controlling blood sugar, quitting smoking, and staying physically active every day. Because the health of our blood vessels is affected by many different things, it is not enough to only improve sleep while ignoring other healthy habits. The body needs balance from many sides: healthy food, enough physical activity, good quality rest, and a calmer mind. All of these work together to help protect the heart and the brain. Father and mother, very often big changes actually begin with small daily habits, starting to sleep more regularly, paying more attention to sleeping position, and learning to listen to the signals from our own body.
Because in many cases, the body is already giving warnings, but sometimes we are simply too busy to notice them. And interestingly, many people only begin to care about sleep quality after health problems appear, even though protecting sleep early is always much better. Father and mother, now take a moment to reflect. Has our sleep truly been good and refreshing all this time, or has the body often been giving signs of exhaustion that we simply ignored? Starting tonight, perhaps it is worth trying to sleep more regularly, reduce staying late, and find a sleeping position that helps breathing feel more comfortable, because small steps that are done consistently often bring big results over time.
Father and mother, thank you for staying with us until the end of today's discussion. We hope this information can help all of us become more aware of the importance of healthy sleep and heart health. Please remember, taking care of our health should not only happen when we are sick. It starts with the small habits we do every single day, and good quality sleep is one of the most important investments we can make for our future health and well-being. If you found this discussion helpful, please don't forget to share it with your family and loved ones. Someone out there may still not realize that sleep quality plays a very important role in keeping the heart and brain healthy. Thank you so much for watching. We wish father and mother good health always, and we look forward to seeing you again in the next discussion.